way to probe, and it's one of the most important things you'll do because it'll give you the map as to where you do your biggest and most important efforts, the root planing. There are over 600 species of bacteria that colonize the mouth. Many of these bacteria only stick to the epithelial cells. The outer layer of skin and mucosa is constantly shedding, and the bacteria that stick to these cells get swallowed. Once the teeth erupt into a child's mouth, however, the picture changes. Now there's a hard surface, a new hard surface in the mouth, the enamel, that does not flake off its outer surface. So bacteria have a hard structure to build their homes on. This new solid area allows for bacteria to build their colonies and live in the same area from generation to generation in the calculus condominiums they build. In addition, there is another new environment for bacteria to live in, a deep groove around the tooth that is covered with gingiva that is far from the oxygen you take in and out of your mouth. This deep groove allows bacteria that hate oxygen, the anaerobes, to live happily. The bacteria that cause periodontal bone loss stick mostly to the teeth, down under the gum line. The bone destruction is immediately next to the tooth surface the bacteria are growing on. So in order to measure how deep the bone loss is, you must keep the tip of the probe on the root surface. Difficulties arise when the enamel is really bulbous and sticks out away from the root, as you can see in this radiograph. Here's a natural tooth. Look at how the enamel sticks way out around and away from the root surface. So if you probe straight up and down, you would hit the interior lining of the sulcular epithelium, and the patient would say, ouch, and you'd think you hit the bottom. But in fact, in order to probe this pocket, you need to come from behind, slide down to the base of the defect. True here too. Look how far out the enamel goes. So to probe this, you need to come all the way in, feel around. Once you find your depth, then you tip the probe as vertical as possible without pulling it back out. Take a look at this tooth. Same thing. Huge curved enamel. If you probe straight up and down, you do not find the surface that the bacteria have been munching away on the bone. You have to be in at an angle. Another difficulty is when the root is snow cone shaped. Take a look at these lower anteriors. These are tiny little snow cones under great big enamel crowns. So if you probed straight down along the enamel, the side of the enamel would hold the shaft of the probe away from the tooth, and you would just hit the sulcular epithelium somewhere. You want to slide the tip along the root all the way down to the bottom till you feel the junctional epithelium at the apical extent of your probing. Another situation is where the tooth is tipped. Take a look at this. Here's your second molar. Your roots are straight up and down, straight up and down, boom. A tipped root. In order to find this defect, you cannot probe straight up and down like you would just looking in the mouth. You need the x-rays up on the light box so that you see this tipped root, and when you probe, you are feeling along the root and down. Look at the angle of the probe in order to find the depth of this defect. Once we found it, then we tip it as vertical as we can, but we do not pull the tip back out. So tipped roots are also another problem. Another one is the bone loss between roots of multi-rooted teeth. This particular patient, for the only thing they didn't have was this. They had every other problem in the world. So for instance, here is a lower molar with two roots. If there was bone between these roots missing because of bacterial activity, you'd have to come down like this and turn and slide under. And then finally also, at any point in time, or any place along the surface of a root, you could have developed a crack. So when you're probing, you don't just look for where you think the defects are, you feel around 360 degrees, because if there is a vertical crack, the bacteria will march down that crack. You don't necessarily see it because you're looking at an enamel, maybe the crack's only in the root. If the bacteria march down the root, along the crack, bone is lost along that crack, and so a crack can occur at any point in time. So that's why you walk 360 degrees around these roots. Always remember, when probing, the deepest areas are where the disease is progressing, and if you don't get to the bottom of the pocket with the probe, you will not know where to concentrate your root planing efforts. So let's begin.
We're going to demonstrate probing on Dexter with Dr. Morgan.
Everybody, in general, everybody brushes but nobody flosses. So one area that builds plaque quickly and bacteria stay there undisturbed is directly under the interproximal contact. So this is where the bone loss is often deepest. So we need to reach under that contact to explore the shape of the bottom of the pocket, and then we will find the deepest spot and then move the probe so it's as vertical as possible without pulling the probe tip out of the pocket. So now we're going to go ahead and probe.
Okay, you can pull this.
You want to start at the top?
Yeah, let's start on the top canine. Okay, so we're going to begin by inserting the probe at the distal facial line angle of this canine.
Now remember, the enamel's fairly bulbous and the root's underneath it, so we have to come in slightly at an angle like this.
Let me zoom in to you. Okay.
It's not like this, it's like this, pointing the tip of the root towards, or tip of the probe towards the root. And you slide down.
So you're going to touch the junctional epithelium at the base of the sulcus or pocket with your downward stroke. Very nice. And then tilt the probe and extend the tip beneath the contact area and touch gently to find the base of the pocket at the junctional epithelium.
Now look, as we turn, we have to continue to keep the probe tipped towards the center of the tooth. It's not like this. It's more turning like this as we go through.
And we will use a walking stroke to come forward over the facial surface using a circumferential probe. And you will take the deepest reading that you find all along that facial area.
From line angle to line angle, the deepest reading from here to here.
Then as we come across the facial, coming towards the mesial, well, we use the same technique we did on the distal, where we're going to angle that probe underneath the contact to find what we talked about this morning called the coal. And we'll take the deepest reading that we find in this mesial section of the tooth. And that's the basics for periodontal probing using a walking or circumferential stroke. Do you want to show a different tooth too?
Sure.
Do a lower?
Sure.
Dexter won't mind.
Quite often, the first molar is very bulbous enamel, and the root's a long ways underneath there. So if you go like this, you can get right into the pocket, but then if you go straight down, you see how the side of the probe is held out by the enamel? That means that I will go down, and the person will go, ouch, because I'm pushing into the sulcular epithelium, lining the pocket, but I'm not down to the bottom of the pocket. So we want to make sure that we turn, keep the tip there, slide down, go underneath the contact, go all the way across, feel where your deepest area is.
So we just went from a 2 millimeter pocket to a 4 millimeter pocket.
Then we tip it as vertical as possible without pulling the tip of the probe back out of the depth and make your measurement. So we're looking at a measurement from directly in the middle, under the interproximal call, out to the line angle. That's one measurement, whatever's the deepest. Sometimes that's the deepest, usually. Sometimes this will be the deepest right here if there's a crack down the root. Then another measurement is from this line angle over to here. So anything we find that's deep, whatever the deepest measurement is, that's the measurement you record. Then we go back here from this line angle, and notice now suddenly I have to go kind of down the throat and come forward to keep the tip of the probe on the root. Going down the root, under the contact. I can feel way over the other side. I can do anything I want. This is my area. Once you know what that feels like, you record the deepest measurement, wherever it is, from the dead center of the contact out to the line angle, whatever the deepest measurement is.
Dr. Morgan, would you show us where a furcation would be on this tooth?
Yeah. Lower molars usually have two roots, a mesial root and a distal root. Usually about in the middle, the roots start to separate down a few millimeters on the trunk. So sometimes if the bacteria like to sit in this little groove here, they'll march right down, around and under between the two roots. So it would be line angle, and then suddenly it'll start dipping in there, and so if you hold your probe straight up and down, you do not feel it. It's down, under, and between. So as you come across, you have to keep that tip on the root, gently feeling, and then suddenly it'll drop between the roots sometimes, and then you'll know you have a furcation involvement. And then you work your way back around, and whatever measurement is the deepest from line angle to line angle, that's your measurement for the buccal reading.
Now you can have a furcation on the facial or the lingual of a lower molar.
Right here, the furcation would be right between these two roots, the mesial and distal root of this lower first molar. Another place furcation is the upper roots, or upper teeth, upper first molars, and upper molars in general have three roots, two buccal and one straight palate. So in order to find the furcation between the two buccal roots, you'd usually find it right here. The interesting thing is that the furcation between the mesial buccal root and the palatal root is actually quite a ways towards the palate, so you often won't even find it this way. You have to go to the palatal side, which I'll show you on this tooth,
Oh, thank you.
and it will drop in right there, quite a ways usually, and because it's slightly to the palatal aspect of the contact, so you find the furcation on the mesial of first molars there. Another very important furcation, 63% of all first premolars, 5s and 12s, end up dividing into two full roots. So that means you end up with a furcation directly under the contact between the canine and the first premolar. So when you're probing first premolar, make sure you keep the tip on the root and slide in and find where that starts separating into two roots. That's a very common place for people to get a lot of bone loss, because you could floss all day long, the bacteria go right down that groove and destroy the bone.
Okay. So that's what we'll be doing in clinic this afternoon in pre-clinic. And thank you, Dr. Morgan, for your periodontal presentation.
My pleasure.